When we look at rates of substance use disorders across race and ethnicity, there aren't big differences in terms of prevalence, but where we see the uh, greatest disparities is in terms of treatment utilization, so access to treatment and also treatment outcomes, right?
Welcome to Collaborative Endeavors, a podcast about how experts from different areas of research come together to tackle big health challenges, leading to better therapies and healthier communities. In this episode, we meet Dr. Mayra Guerrero, Assistant Professor of Psychology in UIC's College of Liberal Arts and Sciences. During her doctoral training in community psychology at DePaul University, Dr. Guerrero began examining community interventions for mental health promotion in veterans returning from service. This led to a curiosity in the ways in which community-based supports and social networks can aid the recovery process, specifically for those with substance use disorders. Now, as a CCTS Clinical and Translational Science affiliate scholar, Dr. Guerrero is exploring this question as part of her mentored career development project.
I proposed a project that is examining how individuals recover from substance use disorders, specifically how do they develop what we call recovery capital, which are internal and external factors that promote individuals' recovery, right? So individual factors can be things such as how they perceive their own abilities to recover, so self-efficacy, right? And then external recovery factors could be what kind of social supports are available to them, what kind of supportive networks are they affiliated to, as well as what kind of neighborhood level factors can promote their recovery or even hinder their recovery. I have a particular interest in investigating how minoritized communities and populations recover. And so my particular project is investigating how ethnic and racial minoritized communities access and develop recovery capital, looking specifically at neighborhood level and also looking at their social networks. One of the areas that when we look at what the research on recovery capital, there is that currently we don't really understand how much about it when it comes to racial and ethnic minoritized individuals in recovery, and that is such an important need that we have because when we look at rates of substance use disorders across race and ethnicity, there aren't big differences in terms of prevalence, but where we see the greatest disparities is in terms of treatment utilization, so access to treatment and also treatment outcome. In terms of neighborhood level, we see that individuals that are in neighborhoods that are disadvantaged, that lack resources, have poor recovery outcomes, right? And so what I'm interested in seeing is what kind of either neighborhood level factors hinder recovery or also can promote it. So do they have access to treatment centers in their own communities? Do they have easy access to mutual help support groups such as Alcoholic Anonymous or Narcotics Anonymous? Do they have other types of community levels supports that can promote their recovery, such as access to religious communities, for example? And so this project really hopes to be able to shed light into what can be done about addressing those health disparities that we see for individuals in recovery. And also the long-term goal is to use this information to develop a community intervention that can better support individuals in their journeys. And the way that I plan to do this is by integrating different types of like multi-level and mixed methods in my data collection. So one thing that I'll be doing is, in order to capture kind of those neighborhood level factors and effects, is doing geographic information systems where I'm able to map out where individuals are located, where they typically frequent, and what types of resources are located in their actual lived space and physical environment, as well as doing something called social network analysis, where I'll be able to collect data from individuals and their own personal networks and seeing who do they typically affiliate with. Are these individuals that are considered supportive of their recovery journeys, or are they affiliating with individuals that are currently using and may make it more difficult for them to sustain or even engage in their recovery process?
Dr. Guerrero elaborated on the ways in which this project will apply key principles of community-based participatory research in order to achieve its goals.
This project is very community based. It's going to be very participatory. I'm going to also have individuals engage in qualitative interviews and also use something called photo voice, which allows participants to take pictures of where the places that they frequent in their neighborhood. One of the great things about the photo voice technique is that when you assign the participants their photo voice assignment, where they go into their neighborhoods and take pictures of places that they frequent, is that we'll be able to give them particular prompts that address the questions that will be asked of them during the qualitative interviews. And so that will serve as a guide of how they'll answer those questions through images, right? And visuals. And so it's really like the visual representations of their responses to the qualitative questions that we'll ask of them. From there, when you're analyzing the qualitative information and you start to develop your themes from that qualitative data, you will use the images to be the visual representations for those themes. So it's uh, such a great way of really incorporating participant voices, both through like orally, right, through the qualitative interviews and also through the visuals, and can capture things that maybe you wouldn't otherwise have if you were just conducting qualitative interviews. So I think it really has participants really reflect about these questions about what about their everyday lives and the places that they frequent, and how those impact their recovery journeys and trajectories. I'm also engaging with a community advisory board aid and provide feedback on the development of the research project from the beginning to the very end. I'm going to engage with the community advisory board to figure out logistics, recruitment, where different sites that would be best to tap into the communities that I hope to engage with in this project. Also, the type of questions that we'll be asking of participants. Is it culturally sensitive? Is it respects their recovery journeys and uses sensitive language? All of those considerations.
At UIC, Dr. Guerrero has a robust mentor team, including distinguished professor in psychology Dr. Robin Mermelstein and Dr. Yamil Molina, assistant professor in the Division of Community Health Sciences in the School of Public Health. I asked her to describe how this team is helping her develop the skills required of an interdisciplinary translational scientist.
The reason that I selected them as my mentors is because I think that they both will equally help me gain specific skills such as mixed methods. I have a background in doing social network analysis and methods, and also doing a lot of qualitative work and quant as well. But my really big missing piece of my own training is developing as a mixed method researcher. So combining those two areas of my research, and so that is one area that I'm hoping to improve. And both mentors have tons of experience in both. I'm also hoping to continue to develop as a community engaged research and doing health related research that's community based, participatory, and developing relationships with a community advisory board and kind of developing in those areas are some of the big reasons that I tapped both Dr. Mermelstein and Melina as well.
Dr. Guerrero and I discussed the ways in which the translational science methods underpinning her study could be applied to other research seeking to improve the recovery journey. She talked about how the concept of recovery can apply to a variety of physical and mental health conditions, from substance abuse to coping with past trauma to cancer survivorship. This desire to examine how social networks and community supports can best support an individual's recovery is what drives Dr. Guerrero as a community-based mixed methods health researcher.
What I'm hoping for my time in the CATS program is to really take what I learned from this project to develop a NIH-R1 grant that will be used to develop a community intervention that helps individuals in recovery. And so I already see like a trajectory and a long-term plan for this work and also for myself and continuing to develop as a community engaged health researcher that has very strong mixed methods expertise and also engages in various different community participatory methods as well in my work. I think by the end of the program, I'll be able to really take my work to the next level, which allows me to really understand the multiple levels of influences on health and well-being for marginalized populations, to really elevate and promote the voices of individuals with lived experiences, right? Which I think is very, very important.
Collaborative Endeavors is written and produced by me, Lauren Rieger, on behalf of the Center for Clinical and Translational Science, aka the CCTS, at the University of Illinois, Chicago. To learn more about Dr. Mayra Guerrero and CCTS's KL2 CATS and CATS affiliate program, visit the links in our show notes. The CCTS is supported by the National Institutes of Health's National Center for Advancing Translational Science through their Clinical and Translational Science Award. Opinions expressed by guests of the show are their own and do not necessarily represent the views of myself, the CCTS, or our funding agencies. You can find more episodes of Collaborative Endeavors on Apple Podcasts, Spotify, Amazon Music, and YouTube. While we do not monetize this podcast, we do love positive feedback. If you like what you hear, go ahead and give us a 5-star rating to help spread the word. To learn more about how you can work with the CCTS to make a positive impact on the health and well-being of our community, visit ccts.uic.edu or follow us on X at UICCCTS. And if you have a little more time, I highly recommend you listen to this trailer for UIC's newest podcast series, Community Level. Thanks for listening.
Welcome to Community Level, a podcast where public health research meets real-world impact. Brought to you by the Community Health Sciences Division of the University of Illinois Chicago School of Public Health. I'm Dr. Kalechi Bay-Lamberts, your host, and each month we'll bring you in-depth interviews with leading academic researchers, community leaders, and organizations making a difference in our communities. Discover the groundbreaking projects and innovative solutions that are shaping the future of public health. Your personal stories and professional journeys that led these experts and community leaders and scholars and students to their vital work. At Community Level, we go beyond the data to explore the human side of public health research and community initiatives. Whether you're a student, professional, or just passionate about making a difference, this podcast is for you. Join us as we bridge the gap between research and practice, one episode at a time. Subscribe now on your favorite podcast platform and follow us on social media for the latest updates. Let's make a positive impact together at the Community Level.